Hey, this is Dr. Paul Firnhaber, and it is time for 10 Minutes of Truth. So today I have another article. This article comes out of Case Western Reserve University, Duke University, and the University of Colorado. It's out of a journal called Health Science Reports, and it came out about a year ago, a little under a year ago, November 29th, 2024. And the name of the article is Association Between Spinal Manipulation, Butybital Prescription, and Medication Overuse Headaches in Adults with Tension-Type Headaches, a Retrospective Cohort Study. I know, it's a long title. Basically, what they're looking at in this study is if you take a group of people and you start them under chiropractic care, how likely is it that they're going to need butybital, which is a barbiturate for tension-type headaches? That's what they're looking at. So it's an interesting study. It spanned 11 years, which is quite a long time. Now, butybital is a barbiturate that is commonly used to treat tension headaches. It works by depressing the central nervous system. Now, that's something that I don't particularly want in my life, but some people think it's okay. Headache drugs can give somebody a headache, and this is called medication overuse headache. The tension headaches are typically characterized by a bilateral or a pressing or a tightening of the head pain on both sides of the head, and usually co-occurs with neck pain in about 90% of the patients. That's really important because what that indicates is the problem may be in the neck causing the headaches. Butybital is an acute headache medication commonly prescribed for tension headaches. Although, now listen to this, it's interesting, discouraged by guidelines, medical guidelines, due to risk of medication overuse headaches. Butybital containing medications have not demonstrated efficacy for headaches in comparison to other treatments or even the placebo, yet it's still commonly prescribed according to this article. Butybital is a barbiturate and it carries a risk of cognitive impairment, dependence, addiction, and headache chronification. Medication overuse headache is a chronic debilitating headache that adversely affects the quality of life, work, and income, and is more impactful than the tension headaches themselves. So that the headaches from the pharmaceuticals given to correct the headaches is actually worse than the headache it was given to correct. But that's the world we live in. This study matched two cohorts of 3,100 subjects each. So there's 3,100 subjects in the chiropractic cohort, 3,100 subjects in the butybital cohort. The chiropractic care does not prescribe butybital, obviously. Therefore, they're not faced with the pressure due to prescribe these medications. Spinal manipulative care is recommended for tension headaches by the U.S. Centers for Disease Control. Now, isn't that interesting? That means that physicians should be referring to chiropractors for their patients who have tension headaches. Systematic reviews have found evidence that spinal manipulative therapy may reduce tension headaches intensity and frequency compared to sham interventions or no treatment. So what they found in this study in a 2-year follow-up was that in the spinal manipulative therapy group, or the people that were getting adjusted, their prescription rate of butybital was 50% lower than the people that went to physicians. So the conclusion of this article was this: adults receiving spinal manipulative therapy for tension type headaches have significantly reduced likelihood of butalbital prescription compared to matched controls not receiving chiropractic care through 2 years follow-up. So basically, this article is another article in a whole line of studies that I presented in 10 Minutes of Truth that show that chiropractic care is better than pharmaceuticals for reducing pain and headaches, and it's not addictive. And if you go to a chiropractor first, you're much less likely to ever get prescribed a pharmaceutical. Now, here's some of the articles that I've gone over in the last several years that talk about the same thing. So there's an article that came out in 2003 that compared medication, acupuncture, and spinal manipulation to pain and headaches. And, well, this is chronic spinal pain. And chiropractic was way more effective. Again, in 2004, there was a randomized clinical trial assessing the efficacy of medication, acupuncture, and spinal manipulation for chronic mechanical spine syndromes. In this study, chiropractic was much more effective. But then we look at some of the other studies that I've gone through. Just a few weeks ago, I did an article that showed the association between chiropractic spinal manipulative therapy and benzodiazepine prescription for patients with radicular lower back pain. In that study, it showed that chiropractic was much more effective than benzodiazepine. Another article that I reviewed two on gabapentin. And the name of the article was Association Between Chiropractic Spinal Manipulation and Gabapentin Prescription in Adults with Radicular Lower Back Pain. Again, chiropractic was more effective, and people that went to a chiropractor first were much less likely to receive gabapentin. Here's another article that came out in 2024, a retrospective analysis of pain changes in opioid use patterns temporarily associated with a course of chiropractic care. Again, in that article, if you went to a chiropractor first, you were 57% less likely to ever need an opioid. And there's several other articles like that. There's one in 2020 called The Impact of Chiropractic Care on Use of Prescription Opioids in Patients with Spinal Pain. Again, much, much less likely to take an opioid if you went to a chiropractor first. And here's one in 2019. This is pre-COVID. It says opioid use among veterans of recent wars receiving Veterans Affairs chiropractic care. Again, veterans that sought chiropractic were much less likely to be addicted to prescription opioids. So there's more articles here that I could go over, and I've gone over every single one of those on 10 Minutes of Truth. And so I just want you to be aware that chiropractic care is a much better alternative than drugs for pain. I can show you at least 10 studies here that show that. And these are studies out of respected journals, good studies that have where they had large groups of people participating in the study, and it showed that chiropractic care was superior every single time. So again, this another study that I just went over today that shows that chiropractic care is more effective than medication. If you go to a chiropractor before you start taking the meds, you're more likely to get better and less likely to be addicted. So we welcome you and encourage you to, at least if you have spinal pain, tension headaches, migraine headaches, come and get checked out. Just see if there's if you're a good candidate for our office. We want to see if we can help you, if we can get rid of the pain without pharmaceuticals. And if we can't help you, then we'll send you to a place where you can get help. But very likely, chiropractic care can help you if you're in a chronic pain situation. So this is Dr. Paul Firnhaber at Lincoln Disc and Nutrition here in Lincoln, Nebraska. If you want to give us a call, our number is 402-488-2220. We'd love for you to call our office and give us a chance to at least do a complimentary health screening and see if we can help you. I'll see you next week.